My name is Dennis Aguila. I am the owner of Aguila Pickleball Physio, which I started back in April of 2024, which I am extremely grateful has brought me so much joy and happiness because this is what I love doing. For doing PT for the last it'll be 37 years here in June. So yes, I like to think of myself now as the Liam Neeson of physical therapy because I have a very particular set of skills that is designed to eliminate pain issues in your pickleball game. So today we're going to be speaking of pickleball injuries, in particular the shoulder pain that's associated with pickleball. And I again can speak from experience, having dealt with severe pain following my car accident and needing rotator cuff repair for the complete severance of my supraspinatus and then tears to the other three rotator cuff muscles, my infraspinatus, my teres minor, and my subscapularis. And I also had a dislocated biceps. I won't show you any scars, but again, it was a very prolonged rehab recovery that again took a lot of help outside of my own knowledge. And as we all know, we can always learn even more, especially about ourselves. So in any case, I can certainly speak from experience when it comes to shoulder pain. Let's talk shoulder pain. As I alluded to before, with my rotator cuff issues, I found that there was this muscular imbalance. I had this epiphany and finally recognized what muscular imbalance meant. Let's kind of rewind back as to what the rotator cuff really is. So we have the supraspinatus, which abducts the shoulder. You have your teres minor, which externally rotates. Then you have your infraspinatus, which also externally rotates. And then you have your subscapularis, which internally rotates. All those muscles, again, are very smallish. They never show up in the gym from trying to work them out. And they're all like fairly mundane exercises, nothing to really show off your supraspinatus like your bulging biceps. So in any case, when I was recovering, I thought of, wow, my rotator cuff really only has two little muscles that externally rotate the shoulder, and then there's 5 muscles that internally rotate the shoulder. Those are severe odds, leading to almost an innate muscular imbalance. So those 5 muscles again that internally rotate the shoulder are huge. They're of course your pecs, your lats, your anterior deltoid, and then your subscapularis, and your teres major. All of those 5 seem to overwhelm, or can overwhelm, the 2 little external rotators. So as we examine the biomechanics of the shoulder, it is imperative that humeral head stays inside of the socket. And if it does not stay within, it will often again pinch when you have that muscular imbalance, pinch in all manner of directions, creating this shoulder pain. And then if we're looking again at permanence in the relief of that pain, you will need to obtain that muscular balance. So after doing any number of flexibility and range of motion exercises to obtain as much external rotation as possible, with a lot of, again, static and dynamic stretching to help open up that chest. And then the next step for me was going to be the stabilization of the scapula, again, to get that chest opened up and that the glenoid fossa opened up to accept that humeral head through those scapular stabilizers, rhomboids, lower traps, etc., that will keep that glenoid fossa receptive to that humeral head. So again, that little epiphany opened up my eyes in my recovery from my rotator cuff repair. So I have eliminated a lot of that crunch, crackle, pinching pain because of this newfound balance. Those exercises are what I call non-glamorous, using a lot of TheraBand into external rotation, again at various angles, etc., etc. I won't bore you with too much of those, but I did find one other little handy-dandy play tool that I found that does in fact help me keep my shoulder, I feel like it's keeping that humeral head in the socket with a much more stable way at various angles. If you think of the story of David and Goliath, he used his sling and a stone. So this is they call it the shoulder reliever. What I found is that if I hold it again out to the side, but I'll hold it out to the side and I'll tell myself, oh, Dennis, remember, muscular balance. I need to retract my shoulders and then stick my chest out and then proceed with this clockwise motion here. So again, it's a sort of a David and Goliath-ish. So again, that I feel all of my rotator cuff tendons in this forward direction getting activated, and then again I can do it in the reverse direction. Again, nice activation, and I try to turn sideways to make sure that I in fact am keeping the right postural angle. So this is again the shoulder reliever that I found to be quite helpful with my stability and keeping up with my rotator cuff strength, which helps immensely in pickleball. So that stability is so necessary in really all the shots. This shoulder is so crucial in so many shots. It's essential really in all my shots, from my forehand drive to even slice shots, volleys. Having that stability, again, so much of pickleball relies on my rotator cuff being able to activate upon that drive, and then without that additional stability within the shoulder, yes, that stability as well as that, remember, that muscular balance, without keeping all of that into play, yes, your shoulder is going to feel the pinch and the grind and that crunch, in particular at your end range, and where I found a lot of my pickleball clients reporting their pain is on their overheads when they're reaching up overhead and again pulling and snapping down. This is when they feel the or as they're reaching back for that lob, that's when they report having these painful symptoms. So now the next reported complaint of pain, we're going to stick with upper extremity, is going to be the pickleball elbow. So if we look back again, if we think about this biomechanically, the pain again is at the lateral epicondyle. What they experience again is this sharp burning pain and tenderness across that lateral epicondyle. I see innumerable amount of players with their straps. There's a lot involved in pickleball elbow, and as I alluded to earlier, it's so much reliant on the stability proximally at the shoulder that can often, if it is unstable, weak, it's going to lead to, again, forces generated at the elbow that will often lead to these symptoms of pickleball elbow. Oftentimes my clients, they will report that pain again with the backhand when they use just one hand. Oftentimes it's my one-handed players that will experience this pain on their backhands, backhand drives, as well as backhand volleys, dinks. They'll feel it when they have to reach down way low to get to those dinks. I myself have experienced pickleball elbow, and after I had made a couple of adaptations to, number one, reduce the shock through an additional overwrap, and they have even more different wraps that can soften the shock of striking the ball. What I found to be even more helpful was switching to a two-hander that allowed me to alleviate so much more stress at my elbow. And then the control, as well as the power, accuracy, and placement has been truly beneficial. So yes, pickleball lessons can often lead to relief of that pickleball elbow pain. So how I end up working and treating the pickleball elbow is I will let them know to de-inflame the area. I myself like a little ice massage, but typically when I've been treating these pickleball elbow patients, I have noted that they have, again, there's quite a lot of this formation of inflammatory scar tissue from, if not months, if not years, perhaps even decades of playing pickleball with the one hand and relying so much on that. And all they would do is simply take their Advil, etc., or rub it with some other creams. But it is again so temporary. But I'll let them know that what I like to do is obtain the permanence by use of my special skills, manual therapy skills, to eliminate much of those restrictions, and then taking them through very specific exercises to improve that muscular balance. So much of, again, is concentrated on this portion of the forearm that is nice and meaty, whereas the dorsal end not quite as bulky and strong. So performing exercises, I like to use this sort of reverse curls with I'll often have a towel tied to a little dumbbell, and then I'll practice rolling up that towel so that I can, again, work on improving the strength and stability through the elbow. But yes, that is pickleball elbow, and that's how I get a chance to treat. So the next reported injury that I see that I currently have clients on right now, again, is back pain. And a lot of my patients will tell me, or they'll show me, "Oh, Dennis, I got to show you my MRI results, and it shows that I've got a herniated disc. Is that why I got so much pain?" And I will tell them that yes, there's probably about 90% of us 60 plus players here that have herniated discs. So that's no real revelation, and I tell them that I do have to examine that part of their back and spine and see, is it truly your back, or is it could be some of that inflexibility up into the thoracic spine. You're not getting enough thoracic rotation or extension because you're kind of hunched over, and then you go out and play pickleball, and then you try to get to those low dinks and low shots. And so I'll do that examination, and then also find out, oh wow, you're lacking a lot of hip rotation. They're not able to rotate externally or internally. Again, so we'll address those areas where I find those deficiencies. And again, I like to treat them with my special manual therapy skills to alleviate and improve some of the soft tissue mobility, de-inflame some of those areas, and then allow them to tolerate many of the homework assignments I'll give them to stabilize, strengthen their lower back, hip inflexibility and instability. And then finding out, they'll report to me, hey Dennis, I played so well, I won my ladder tournament, etc., etc. And that is gratifying to know that I've been able to make a difference for them. So that is it in a nutshell. Thank you for coming out and listening. So we'll catch you on the next time. Thank you so much.